I'm Jim Gale. I'm a professor emeritus in the Department of Epidemiology in the School of Public Health and Community Medicine. I have been emeritus since 2004. I came to the University of Washington in 1967 as a postdoctoral fellow in what was then the Department of Preventive Medicine at the University of Washington School of Medicine. Before that, I grew up in the East Coast. I was born and raised in Massachusetts. I actually lived in the town of Andover, where I was a day student at the private boys' school there. I then went to Harvard as an undergraduate. I went to Columbia Medical School in New York City, which was my first foray educationally outside of Massachusetts. And in those years, we were all worried about the draft, and we were all liable for the selective service. And following my graduation, I had a residency at Bellevue Hospital on the medical service, which was the Cornell service. And at the end of my internship year, a fellow named David Schottenfeld, who is, I believe, a professor of epidemiology now at the University of Michigan. At that time, he was at Memorial Cancer Hospital in New York City. He came down and talked to us about something called the Epidemic Intelligence Service, which was in the Public Health Service, but it had the fortunate attribute of fulfilling one's draft obligation. So if one signed up for the Epidemic Intelligence Service, one then fulfilled that obligation and didn't have to do other less attractive alternatives, which for me at that point would have been being assigned to a military base in the States, taking care of dependents probably. I think that the Vietnam War at that time hadn't really heated up. It was 1963, 1964, and the chances of going overseas were slim. However, Dave Schottenfeld gave such an exciting presentation on the Epidemic Intelligence Service that I thought that that would be a good alternative. I signed up and was recruited into the class of 1964, and they had at that time, they got a lot of very good people from around the country because it was a very good alternative kind of service. And I let it be known to that service that I was interested in serving overseas. And so the class only was about, I think, 40 graduates at that time. And so they had enough people that they tried to honor everybody's wishes. And thanks to people, knowing colleagues and so on, I was assigned after 6 months in being in Atlanta to go down to Panama with the Middle America Research Unit with a fellow by the name of Carl Johnson, who was a virologist and epidemiologist and doing all kinds of exciting things, including discovering Bolivian hemorrhagic fever in the northern part of Bolivia. It turned out he was a friend of John Fox's, one of the early founding faculty members here that Tom Grayston had recruited. And so when I fulfilled my 3 years of service, I upped for an extra year because it was so much fun going up and down Central America looking for viral diseases. I had taken advantage of my assignment from Atlanta to Panama to actually drive down over the Pan American Highway. In those days, it was perfectly safe to do that, and I had a friend of mine who came with me, and we used to camp out by the side of the road and never thought anything above it. I do remember waiting at the border, crossing from Mexico into Guatemala, and we arrived at 5 minutes to 12, and the border guard said, "Sorry, we're about to close for lunch for 3 hours." And we knew that they were putting us over a barrel, so we basically slipped them $20 US, and they stamped our visas and allowed us to pass, so we didn't have to sit at the border for 3 hours while they ate the lunch. Anyway, it was through the good offices of Carl Johnson, who knew John Fox and knew Tom Grayston, that at the end of my time there, I was originally scheduled to go back to do a postdoctoral infectious disease training in Boston with a prominent infectious disease person named Louie Weinstein. And I wrote to Louie Weinstein and said, thanked him very much for my appointment, that I decided to pursue a postdoctoral traineeship in epidemiology. And I had a choice of either going to San Francisco with Dr. Bill Reeves, who was a very well-known entomologist and chair of the Department of Epidemiology at Berkeley, and or coming up to Seattle. And Carl Johnson felt that those two programs were the only programs worth their salt in infectious disease epidemiology. I should, as a little bit of an aside, point out that Dr. Weinstein wrote me a very curt letter telling me that he hoped I realized how many people I had deprived of my position, and it really wasn't very courteous of me to decline him at such a late date. I didn't reply to that one, but I felt this was my life and not his, and I didn't waste too much sleep over the fact that I turned him down in April when he had to fill the job in July. Anyway, I made a trip to Berkeley to visit with Dr. Reeves, and a trip to Seattle to visit with Dr. John Fox and Dr. Tom Grayson. And although I didn't know Seattle as well as I knew San Francisco, I didn't actually know either one of them. But being an East Coast person, I thought I had heard more about Berkeley and the Bay Area. But they wanted me to do a PhD, and I really didn't want to go through another 4 or 5 years of training after I'd already had 3 years of internship, 3 years in the public health service, and 4 years of medical school. I said enough is enough. And Tom Grayson and John Fox said, if you come with us, we'll give you a master's degree at the end of 2 years, and you will be trained in epidemiology. And so that's the path I chose. I remember coming into the school, and it was a very collegial kind of affair. We were right away treated as peers amongst the relatively small group of faculty, some of whom I know have been interviewed for this series. They included Tom Grayson, who was the chair of the department, John Fox, who was a very eminent infectious disease epidemiologist who'd originally been with the Rockefeller Foundation in South America and chasing after yellow fever, had then, I think, gone to Tulane, and then eventually to New York City, where he'd been with the Public Health Laboratory in New York City. And Tom Grayson had, I think, very astutely recruited him back into academia. Another person who was already here was at the other end of his career, because he was just starting out, was Dr. George Kenny, who was a microbiologist fresh out of, I believe, the University of Minnesota. And I became very close to George because he ended up being my thesis advisor, and I worked on mycoplasma with him for my master's degree. Other people that I remember fondly were Russ Alexander, who was very close to Tom Grayson, and I think Tom told the story that Russ was the first person that he called to recruit to come to his new department of preventive medicine when he was recruited to come here on his way back from Taiwan to the University of Chicago in 1960. So remember, this was in 1967, when I interviewed here. So it was only 7 years after that group had been pulled together. Another memorable founding faculty member that I remember was Donovan Thompson, who was head of the then division of biostatistics. There was another fellow who was head of environmental health, whose name I'm not remembering at the moment.
John Wilson?
No, this was before John Wilson. This was, I'll think of it in a minute. And of course, we never heard of a department called health services, or we weren't even sure what that discipline or department might cover. So we were really biostatistics, a microbiology division, which George Kenny took care of, an epidemiology group, which most of us were, including Grayston, Fox, Alexander, and then we had some laboratory people. Bettina Wentworth was a faculty member, and then Dr. Cooney, whose first name I'm not remembering, also was associated with Dr. Fox and worked with him in his laboratory studies of something called the Virus Watch program. One of the things, those 2 years that I was in a fellowship here were very exciting because we weren't very many fellows. We were, I think, 5 or 6 of us. No, I should have mentioned Dr. Kittitas County, who was here. She had was in the process of completing her PhD. She was a physician trained in Sweden, I believe, and she had just joined the faculty. But she was definitely, I considered her as a peer, and she'd worked very closely with Drs. Grayson and Alexander on their studies of respiratory diseases. The thing that really impressed me about this group was that they made such terrific use of the existing populations to study infectious diseases. And one of the first studies that I know they engaged in were studies of pneumonia in Group Health Cooperative. Group Health at that time was one of only a few prepaid medical plans. I know when they were started in Seattle in 1946 or 48, whatever it was, I think they were labeled communist because they were not fee-for-service. It was a prepaid operation where people signed up and they were enrolled, and from an epidemiologic point of view, they constituted a defined population. So you knew how many people were in it, you knew what their ages were, who they were, you knew a lot of things about them. And by then very carefully monitoring them for their disease rates, and in this case, these were cases of respiratory disease, particularly pneumonia, you could actually calculate a rate of pneumonia in an open population living in a city. And there were very few people who were able to do that in this country because those populations weren't enumerated. And so you could actually get a rate of so many cases of pneumonia in this defined population for this year. And they didn't just study pneumonia. John Fox had an ongoing study of viral diseases, which he called the Virus Watch, in which he was studying the common cold. And that was a much harder thing to study. He and Marion Cooney were culturing people, whether they were sick or not. Every 2 or 3 months, they would culture the throats and the nasopharynxes of children, of adults, and follow these through time, whether someone was sick or not, and then correlate these viruses with the occurrence of respiratory illness to see if there were any serotypes. And there were many, many serotypes of rhinoviruses and adenoviruses and a variety of these microbes that were associated with illness, but people hadn't really been able to sort out which ones were more virulent, which ones were just passengers, how long people kept them in their nasopharynx, when they shed them, and what the relationship was to which clinical symptoms. So it was a very interesting and complex study. And John Fox was a master at putting that all together. I should mention, and I won't spend the whole time on these early years, but I should mention that the classes we took, my other fellows who were with me in the same class included Dr. Palmer Beasley, who has gone on to be great things. He was in Taiwan, where he did a long study of hepatitis and cancer of the liver in Chinese military people. He then went on to, after a short stay in San Francisco, to the University of Texas, where he's been dean there for a number of years. Another person that was with us in the same group was Dr. Ron Roberto, who was just a wonderful guy. He was a Californian. I remember in the first year going down to California, because I was new to the West Coast, and my wife and I, we didn't have any children. We went down to California and stayed with Ron's family, who were old-time Napa Valley. They lived in the town of Napa, California. His dad was a winemaker, and Ron became the head of communicable diseases for the state of California. Ron never did go into academic epidemiology, but he was a practicing epidemiologist in the state of California. And I honestly haven't heard from Ron for a number of years, so I don't know. I know he doesn't still have that job, but I don't know where he is at the moment. We had 2 Chinese colleagues, Dr. C.C. Lin, who from National Taiwan University that Tom Grayson had brought over here through contacts over there, and Dr. Ted Kuo, who both of whom were in our class, in that entry class. And Ted Kuo has become a distinguished faculty member of ours in the Department of Pathobiology, working with Dr. Sanpin Wong and Dr. Grayson on the trachoma virus and various chlamydia infections since that time. I think there were 2 or 3 other fellows that we had, but there weren't more than 8 or 9 of us. And I remember we'd all go off to different faculty members' houses for parties. That was in the days when we weren't quite so busy somehow, and we would go to picnics and celebrate parties, and it was just a lot of fun. It was like one big happy family, I think. Another important event of that 2-year training period, I think it was after the first year we'd completed our coursework, and Tom Grayson had lived for 3 years in Taiwan and worked up an outbreak of rubella on Taiwan in 1957. Well, we had just entered our schooling in 1967, and so it was exactly 10 years later that rubella appeared again on Taiwan after having been absent for 10 years. And when you think about it, it's a very interesting phenomenon because an island population didn't have as much opportunity to have rubella introduced over the intervening 10 years. So by 1967, there was all the people below 10 years of age had never been exposed to rubella. They had been protected by their island status. At the beginning of that year, rubella was introduced again, and some of Tom's fellows who'd worked with him before, Dr. Roger Dietels, who was the dean, eventually became the dean of UCLA School of Public Health, and has a distinguished career as head of the Department of Epidemiology there, one of Dr. Grayson's trainees. Dr. Laura Gutman, who's a pediatrician, all worked on this rubella vaccine trial, and Palmer Beasley and I were sent over as 2 fellows who'd had experience working overseas, working in countries which didn't have necessarily all the amenities of our own country. And we participated in this vaccine trial that consisted of inoculating some 6,000 to 7,000 Taiwanese schoolboys, all of whom were under the age of 10 years of age. So that was grades 1 through 5 or 1 through 6. And it just turned out to be a very neat sort of natural experiment where these kids were all susceptible. We knew the epidemic was going to happen. We immunized half of the boys, and we immunized with this new candidate rubella vaccine. The other half we gave polio vaccine to. It was a blinded study, so neither the boys nor we knew who got which vaccine, and we monitored the classrooms for clinical cases of rubella. We didn't do any blood studies at that time, but it was basically a study of clinical suppression of rubella vaccine. And fortunately, the timing of the epidemic was such that we could show beautifully that the boys who got the vaccine didn't get rash disease. The boys who did get the polio vaccine developed rubella clinical disease, and at least clinically, this vaccine was effective. Subsequently, there were more trials with blood studies being done, but I'm sure this was the largest clinical trial with this vaccine at that time. And of course, it gave Palmer and myself a wonderful field experience as to how to conduct the trial. And we did manage to write some papers, and that was just a terrific experience as part of the training here. At the end of that 2-year period, Tom Grayson turned to each one of us and asked if we'd like to join the faculty. Well, by this time, my career in clinical medicine had been completely set aside, and I really didn't have any other place that I thought I'd rather go, and I thought it was very nice being here. I liked the personnel, and this seemed to be a department that was on the rise. And looking back, of course, it was a department that was on the rise. There was a lot of federal money. The new building had just been built. Money was flowing in those years, and this was a department that was going to get built. And so we finished our degrees in June of 1969, and the first thing that Dr. Grayson asked me to do was would I like to go to Taiwan to be a junior faculty member in Taiwan as an assistant professor. So I went right back to Taiwan, and he'd had faculty member there ever since 1960 which was the end of his 3 years. He'd gone there in 1957, and then he'd always managed to have faculty and fellows over there. Dr. Alexander, Dr. Emanuel, and after I was there, Dr. Beasley went there. So it was a very nice continuity, both with the Americans who were here and our Chinese colleagues, some of whom emigrated over here, some of whom stayed over there. And from a personal point of view, it was a very rich experience. 2 of our 4 children were born there, and it was a wonderful place to live. The research opportunities were fabulous. We worked at a naval medical research laboratory called NAMRU 2 with excellent Chinese staff, public health nurses, a full laboratory, where I had the opportunity to work on sexually transmitted diseases, as well as help with some of the studies that Doctors Grayston and Wong were carrying on trachoma. And it was just at that time that Dr. Alexander was beginning to get interested in the genital transmission of trachoma, and which subsequently ended up turning into chlamydia infections, which we now know is an important cause of non-gonococcal urethritis.
One of your closest friends and colleagues in epidemiology was Palmer Beasley. Please tell us more about Palmer, if you would.
He went to medical school here.
Okay.
And I think he did his residency here, and then he went to the Centers for Disease Control. And he was a year ahead of me there, so he was a senior. He was 1 year senior to me, and he was the lead when he and I went to Bolivia to investigate an outbreak of bubonic plague. And that's a sidebar to this story, but it was one of the most dramatic stories. But we went down there for 2 weeks to look at this outbreak of bubonic plague. We ended up exhuming a grave way on the eastern side of the Andes after traveling by burro and donkey. And so Palmer and I had bonded pretty well through this stuff. And when he and I went over for the first time to Taiwan to do the vaccine study, we had a really quite an adventure during the winter. We went in, actually it was over the New Year. We were going to Japan, and Palmer said, if we're going to go to Japan, I want to see a little bit of it. And he had grown up in California and was more sensitized to the Japanese experience. I didn't know enough about it to know that I should stop and see it. And so I'll never forget New Year's, over the New Year celebration, Palmer and I in a Japanese ryokan in the town of Hakone, which is a very... It's a well-known holiday place. The Japanese go near Mount Fuji to celebrate the New Year. And New Year is a very big holiday. I'd say it's a bigger holiday than Christmas in Japan. And so this must have been in 1968, New Year's in 1968, I would guess. It may have been 1969. Anyway, funny stories of Palmer and me going in. It was below freezing. We were very cold. We didn't quite know what to do. And this wonderful Japanese hostess coming in, and we weren't quite clear what the intentions were of this lady, and she was telling us that we needed to change into something a little more comfortable, and we were kind of laughing because we weren't clear how this was all going to turn out, and so we started to take off one layer too many, and she said, no, that's not quite what I had in mind. And it wasn't that we were necessarily, but we were trying to do whatever the appropriate thing was. And I remember going into a wonderful hot bath there where it was hotter than you could stand it. And then we had a wonderful meal served in our room, but no heat. It was absolutely no central heating whatsoever. So we were bundled up. You could see your breath. And this wonderful Japanese lady bringing in our hot food. And it was a totally Japanese experience when I thought I was in school. Anyway, there are lots of other stories.
Yeah, we'll ask Palmer.
So you can ask Palmer, and be sure and ask him about K.P. Chen, because he was a wonderful man who knew Tom Grayston from the years that he was over there. And K.P. Chen opened up all kinds of doors for us. We had to interview. Our time during this study was mainly going around interviewing school principals in these very large grammar schools and primary schools and grammar schools in Taiwan, in Taipei and Taichung, and sipping tea in the cold winter and asking if we could enroll these kids and explaining what the study of rubella was about and why it was important and that we weren't going to vaccinate the women, the girls, because we didn't want to deprive them of any natural immunity they might get with the wild Rubella virus. That they could, in fact, if the vaccine was less than totally protective, it might protect them, say, for 5 years, and then when they started having children, then they were susceptible again when they thought they were protected, and we didn't want to risk that until we knew that the vaccine was good. So we gave it to the boys to show that, in fact, it did work. Anyway, that's a little sidebar on the Taiwan experience. As I say, I spent three years in Taipei from 1969 to 1972 as one of my first years as a University of Washington assistant professor. During that time, you will notice that was over the time that we became a school of public health. And I believe that it was John Fox and Palmer Beasley, who was then a young assistant professor, and others were writing all of the necessary paperwork to make that transition. Some of the things that helped us move from being a large department of preventive medicine to a relatively small school of public health involved applying to various agencies, there was federal money available to us, and I'm sure Dr. Grayson has told you that strategically it was a good time to make that move because the deanship of the School of Medicine was not filled. And in many instances, a dean of a School of Medicine would not allow a large successful department to get out from under, so to speak. They would find lots of reasons why that wasn't a good idea. In fact, we always tried hard to maintain our obligation to the medical school to provide them such services as teaching the medical students epidemiology, providing biostatistics consultation, so that we hopefully head off the possibility of the medical school founding another department of preventive medicine. In some other universities, they'll have both a department of preventive medicine and a school of public health. And that is where you get into turf wars. And I thought a little bit about this. One of the nice things about being at the University of Washington was that the turf wars were kept to a minimal. I don't know whether it was because it was a relatively new school. The medical school, after all, was founded after the end of World War II. Our preventive medicine department was in 1960. And so, but in some other cities and big universities, they have both. And there's certain populations are off limits to study, whereas in this, for example, if we'd wanted to do a study in group health and the medical school was already there with their investigators, they could cut that off, and that would be it wasn't so easy to collaborate. That occasion never arose here. It was always a collaborative enterprise, in my experience. When I came back, I then began really taking my responsibilities as a faculty member here. I think one of the first courses I taught was Epidemiology 511. And I began writing grants because the whole nature of surviving around here was getting grants. Dr. Grayson, when I first started as a faculty member, helped me. In fact, I'm sure was largely responsible for my getting something at that time was called a Career Development Award, which provided my full salary for 5 years and was a wonderful boost up. And that's an example of how money was much more liberal. Now I think they have some sort of faculty awards for new faculty, but it's never for 100%, and it's never for 5 years. It's always for less, usually 3, I believe. So times where the money was a little bit more accessible at that time. Over the next years that I was here, I was involved in infectious disease research. I was very interested in a study of adverse effects of pertussis vaccine. Was the contract with the Centers for Disease Control, where we put the entire populations of babies that were born over a 2-year period in the state of Oregon and the state of Washington and monitored them for serious neurological events, including encephalitis, strong seizure disorders not associated with fever, paralysis of one kind and another. and looked at those in association with a prior receipt of pertussis or whooping cough vaccine to see if there was any temporal relationship within 2 weeks of receiving the vaccine and then subsequently developing one of these bad permanent neurological disorders. Because you may recall in that vaccine, which is the whole cell vaccine, there were a lot of parents who were concerned that the vaccine was causing severe neurological damage to children. The interesting thing to me about that study was the way that it was set up. We located a control child, a matching child who did not have a neurologic disorder, who was born at the same time in the same county as the ill child, and then looked to see if using the index date in the ill child as to when they became ill, backing up 2 weeks to see whether both the ill child and or the control child had received vaccine during that 2-week window. We could then compare it and see if the vaccine was more frequent in the ill children than in the control child. And this is a way to study an event, an exposure like vaccination, to which everybody was exposed. Both all of the well children, the controls, and the ill children received vaccine. They were supposed to receive 3 doses. So it wasn't a question of somebody not getting vaccine. The question was, did they receive the vaccine in a close temporal relationship with the illness? And it was a very involved, very long study. In fact, we did show an increased risk, but the sample size was so small that it did not reach statistical significance. By the time they were getting to the point where they had to decide, did they want to fund a larger study, they changed the vaccine. So they decided that it was not going to be worth answering that question. But the logistics of that study was still very, very large. And then after that study was done, one of the most important things in my career here was that I became involved with the Northwest Center for Public Health Practice and eventually became the part-time health officer over in Kittitas County. And that was arranged through Dr. Bob Atwood, who was known to the school. He worked for the State Department of Health for a long time. And he lived in Yakima. He'd left the state by that time, and he was a health officer for Yakima, Grant, and Kittitas counties, among others. And he was ready to have someone else take over for him to be the health officer in Kittitas County. And for me, it was a perfect match because I could get over to Ellensburg and back in the same day. And the county was very interested in having somebody from the university assume those responsibilities, and we turned it into a training opportunity because we had a preventive medicine training grant, and we would get one of our preventive medicine residents, a medically trained person, who would come over with me, and they came over once a week. I came over 2 or 3 times a month, and we met with the Board of Health, and we were responsible for running this very efficient small health department consisting of about 20 full-time employee equivalents, and a population of about 27,000. And it was on the ground, real public health practice, Eastern Washington sensibilities. They were kind of suspicious of the West Side I-5 corridor mentality, but something worked because we were there for a total of 13 years. We had some wonderful relationships in the community, worked with the Central Washington University, and a number of wonderful, faithful citizen advisory groups that helped us as each issue came up. We also worked with Amy Hagopian and Peter House from the School of Medicine, who were very interested in rural health in the state of Washington, and they came over and facilitated meetings with our community advisory groups. And it was basically a very satisfactory and successful relationship between the university and Eastern Washington. I'd like to say that I think the school has always been sympathetic to folks in public health practice from the very beginning. I do remember a meeting that Russ Alexander convened with local health officers in the 70s with a fellow named Phil Jones from Whatcom County, and there was somebody from Eastern Washington, and there were 4 or 5, and I think John Baer from the Department of Health, and sitting around in our conference room in F348 talking about ways to increase collaboration with the school. We spent about a half a day, and the atmosphere was very collegial, And one thing that Russ put into my mind was the importance of public health practice, and that we were peers with them. We were not in any way superior. We needed them, and our whole mission really was to support them and make people healthier through public health practice as well as research. So that when the Northwest Center for Public Health Practice came along, I think that was an opportunity that came over a Christmas break when Gil Oman and Mark Oberle wrote a grant that was due that none of us knew about, and they killed themselves writing this grant in either 1990 or 1991 to start a center which was going to link the school formally with people in public health practice. And of course, the history shows that we were successful in that application. And the one thing I remember Gil Oman regretting was that he hadn't asked for more money, that he had stuck to the guideline that they'd given him, and then it turns out that the money wasn't all dispensed, and he could have asked for more, but he didn't. And he feels that that's a grantsmanship issue, that don't necessarily limit yourself to what they say. They can always cut you back, but at least legally they couldn't give you more than you'd asked for. So Mark Oberle was the first head of the Northwest Center for Public Health Practice. Shortly after that, they recruited a former health officer from what was then called the Seattle-King County Department of Public Health, Jess Tapp. And I think Jess was half-time working for it. And basically we called together representatives both from the State Department of Health and from various counties. We still were, and I think the most tangible thing to come after those early years was the assessment first of what kinds of training needs did the folks in practice feel they wanted. I know Chuck Tresser was involved with that, and they did this needs assessment of what they needed. And one of the big things that came out of it, they wanted training in epidemiology. And so from the very first training effort that we had, we were sure to include epidemiology in that summer institute. And we've had a summer institute continuously since 1991, I believe, up to the present time. Originally it was 2 weeks, and then it became very difficult for people to get away for that period of time. So we cut it down, and now it's for 1 week. But it's still well subscribed. And of course, the problem for the practitioner is, one, finding time to get away from his or her job. And secondly, we eventually ran out of money. We originally subsidized it through money from our funding source, which was the Health Resources and Services Administration, or HRSA. Those grants slowly got cut back, and we had to charge tuition for it, and the health departments couldn't pay for it. And furthermore, they were hit doubly. They lost the time of the people who were in the department, and they couldn't bill for the services if they weren't there. So they weren't getting paid, and then they had to cough up some more money to pay us. And so there were some tight spots. However, recently I think we've done quite well by everybody, because we put the theme of our institutes around training for emergencies and bioterrorism a couple of years ago, and now the rubric we use is preparedness. And nobody can be against being prepared, but the core programs have been pretty much the same. Health management, policy, how do you make policy, working with community groups, and then some topical issues such as how do you prepare yourself and plan for emergencies, which is always a good thing, whether it's a natural emergency or some kind of a calamity. And that institute is still carrying on. Most recently, I think we hit the big time again in about 2000, when both HRSA and the CDC offered grants of $400,000 and $500,000 each a year to schools of public health. And I was the principal investigator on the CDC grant, and Mark Oberle was the principal investigator on the HRSA grant. And we merged them together. Many schools didn't do it. There was one of them was charged with training. The other one was charged with helping people get prepared. And I personally myself had a little trouble teasing them out but we managed to interdigitate them in such a way that both agencies were pleased with the way we did it. We weren't considered that we were double dipping, and that was the whole name of the game, was not to turn them in. We made a big deal out of the fact that we were the only school west of Minneapolis and north of Berkeley. And I remember, I think it was Jack Thompson or somebody who got the idea of superimposing our 6 states, which included, they didn't quite overlap with a whammy. In fact, I think we tried to use whammy once, but the medical school didn't like us taking their phrase. So our states were Washington, Alaska, Montana, Idaho, Oregon, and then we included Wyoming as well. When you superimpose that map over the entire, it reaches the entire width of the United States because Alaska is so big. But it's the geography. Our population density wasn't so great, but we have a huge area. So as far as I know, we never got cut. We got sometimes the years were lean and we didn't get increased, but we could make a pretty good case. And we pulled together yet another group of talented people. I faded back. Jack Thompson then took over the leadership of the center from me. I should have mentioned that in there between was a time that I co-chaired the leadership with Patrick O'Carroll. And Patrick, I don't know whether he's been mentioned in this group or not, or whether you're going to interview it. Patrick was a CDC assignee, a mid-career officer who was assigned here, much as Mark Oberle had been assigned here, with a CDC salary to work at the university, and he was here to help us develop our capacity in informatics, public health informatics. And he, I think, was here for 2 tours and subsequently became the director of the Region 10, which is the Northwest, for Health and Human Services. So he's in the area, he lives in the same place, he still serves on our board. He now wears a public health service uniform, and he is about to be formally promoted to Rear Admiral, which is a great distinction. I think he may have already made it. I got a very fancy invitation to his ceremony back in Washington, D.C., so I had to regret it. But Patrick has added a great deal to that center, as has Jack, and Jack Thompson has been a superb leader and networker at the both state level and the local level. He's been very active in national organizations with public health practice, and added a dimension that I certainly didn't have the experience to do, and I think has taken us to a new level. We now have very strong relationships with the tribes in this area, and we've worked very hard at our relationships with the state Department of Health, and I think Jack regularly meets with the directors of those 6 states and Patrick O'Carroll, who convenes the group on a regular basis. Now, I think one of the things that ought to be talked about is, and I think has been I don't know if it's been a change, but I think we were very strong as a research institution. And some of the issues and some of the fears were that by becoming a school of public health, we would lose our research focus. And some of our faculty were worried about that. And I think for a long time we did focus on research issues and training researchers. And I think that in recent years we've broadened that a bit, and so that with the stories that I've just told you, we do have a strong emphasis on public health practice and making that relationship. It's my perception that we have not lost our ability to do good research. I think that the faculty is a little more spread out, so I'm not clear that we have the same depth in research that we once had, and particularly I think in infectious disease research, which attracted me here, and I was working with George Kenny and Tom Grayson and Russ Alexander, that presence is not as strong, and that a lot of those activities have moved over to the medical school. That's just the way it is. Our laboratory space, some of it's been taken over the medical school, and that's the way we evolved.
One observation that I thought was interesting was that our relationship with the medical school has probably, especially with this new Department of Global Health, has probably been strongest with Pat, who's the only non-doctor that we've had for a dean.
I think that's true. I think that's probably true. I think she's not seen as a threat, but she's very candid, and I think she's very willing and able to make her points and is respected for it. I think that's my observation. And of course, on a national level, she's a leader. She's about to be head of the Association of Schools of Public Health. I think during her first year as dean, she made it a point to visit every single one of the 39 counties in this state. And Mark Oberle, her associate dean for public health practice, took her with him. And she came, in fact, she came out to visit my county when I had been there. I can't remember when Pat started, but I remember it was a great honor when she came in and sat and at our Board of Health meeting with the 3 county commissioners, and they were looking at Pat, and she was just as friendly and made them feel relaxed. I think they were a little nervous of a dean of a school of public health coming over there. Anyway, she did a nice job.
Jim, one of the most important figures in epidemiology was Russ Alexander, and I'd like you to tell us a little bit more about him, and if you could add anything about Donovan Thompson.
Well, I can start with Russ, who was he was funny. He was very candid and very human, and he absolutely identified with students. And I would say that he made you feel that he really cared about you. And I will say, for those that he didn't care about, he didn't waste a lot of time with them. He wasn't rude. But I think when he did spend time with you, you felt very supported by him. And I think a lot of students, both or mentees, I should say, people that whom he mentored, felt that way, whether in the school or in the health department. He was a very curious man, but willing to stand up to anybody. And one of the most best known nationally episodes is when the swine flu outbreak came out in the 80s, I believe it was, and they were worried about getting vaccine geared out. You may remember that was the epidemic where they had a couple of soldiers at Fort Dix who died due to swine flu, and the question was this going to be another reiteration of the flu epidemic of 1918? On the basis of all of the evidence, Russ decided that he didn't think it was a good idea to go ahead, and he told everybody that he didn't. And he was the one person who said, I don't agree with this. And of course they wanted unanimity, and it turned out that he was right. I'm not suggesting that they shouldn't have gone ahead with it. So they did go ahead. They made a lot of the vaccine, and then you may recall that one of the side effects from all that vaccine was the Guillain-Barré syndrome, where people got ascending paralysis, and there was a lot of morbidity due to the vaccine. And if they hadn't administered it, they could have avoided some of those side effects. I think that Russ, he was very loyal, and if he knew you and said he was going to back you, he was in Taiwan during part of the time that I was there, and we had a very cordial relationship. One of the funny stories was when we had just moved into our house. I think we started off living in a hotel in Taiwan, the Palace Hotel. It was Madame Chiang Kai-shek's hotel. It was a very nice hotel. And but eventually all good things came to an end. We had to move into our house, and it was during a typhoon. And the things had been moved in the day before, but the day that the family actually moved in, the water was up to my knees. And we had one child who was 1, and myself. And I sort of looked around and was wondering, was this typical? And was the water going to stop, or was it going to keep rising? And I looked out across the street, and there was an apartment house across the street, and there was Russ. And he said, "Hi, Jim." And he was up on the 3rd floor looking down at the balcony, sort of chuckling away, saying, "Don't worry, it's going to be okay." And here we'd moved in opposite each other, and I hadn't known he lived there. And it was just one of those funny coincidences. And the water did go down, and we never had another typhoon while I was there. He had a great sense of humor. He loved to laugh. I think and the other thing about Russ was he wasn't afraid to pick up and move on. And so in our school, he became the first chairman of the Department of Epidemiology. He then decided that he was the chair of the Faculty Senate. He was on the search committee that brought President Gerberding to the university. And he then decided that he had enough of administration, and so he decided he wanted to go back to clinical medicine. So he resigned from the university and went down to Tucson with the University of Arizona and took a residency in pediatrics again at a good adult age, middle age. I don't remember what the years were exactly. And I think lived in Tucson for 5 years when he decided that his first love was research. So he went back to the CDC and was head of the research section of sexually transmitted diseases and did a lot of good in directing what had become a very active national. And of course, he'd had experience in his own research dealing with chlamydia and genital infections, and was a good person to do that. And they loved him while he was down there. Eventually, Seattle called again, and his final move came back to Seattle, where he took the position of Director of Communicable Diseases in the county. And of course, he was an affiliate faculty member, but we didn't see him much up on the university campus. He was busy chasing down epidemics, working very, very hard until he finally retired after the turn of the millennium. I can't remember exactly what the year it was. But I think in each one of these places, he left a huge hole when he left, and lots of people attested to how much he had given them support. So I can also, let's see, Donovan Thompson was just a very approachable guy, very common sense, didn't always have a lot of patience with people who didn't make common sense. I remember one day Donovan asked me if I wanted to go skiing with him. And at those times I was so interested that all of my superiors sort of felt it was okay to take a day off if you just felt like it. You could just do it. And I was sort of looking around, and I decided, well, if Donovan's going to do it, I guess it's okay. So he and I went in his car down to Crystal Mountain. And I just remember the main thing of the day, I don't remember a lot about it, but I remember being stopped by a cop and Donovan getting a ticket. And he was furious. He said I wasn't going too fast, and the cop just glared at him. And the thing that was particularly annoying to Donovan was that he'd been stopped by the same cop 2 weeks before. And the cop had let him off. And there was no way he could get out. And it just spoiled his whole day. And he just was, anyway, he was a wonderful guy, unassuming, very smart, and a real loss when Donovan finally retired. I think he did a stint as an acting dean as well.